Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today, of course, is Dr. Ricky Johnston from Gastroenterology and Associates. Welcome to the show, my friend. Nice to see you again.
Thanks, Troy. Nice to see you as well.
Okay, well, let's talk a little bit about updating all the audience in regards to your practice and COVID-19. How has this affected the practice since we last spoke?
Well, we've started to ramp back up. I think the last time we spoke, our volumes had dropped pretty dramatically, both because of patients' fear of getting out, and also because of Department of Health recommendations and guidelines that had limited elective procedures for a while. Since then, they've reinstituted allowing elective procedures. So we resumed all of the screening type exams that we had not been doing for a couple of months. And so we ramped back up procedural wise. We're doing close to our normal amount of volume. We still have a few patients that are holding out, because of concern. But for the most part, we're getting close to a normal functioning level.
Well, that's what I was just about to ask you. You're performing all normal routine procedures now?
Yep, that's correct. For a while, we were just doing kind of urgent or semi-urgent procedures that needed a evaluation, or people were having symptoms that needed a more urgent evaluation. And we had not done really any elective, just routine colon cancer screening or follow-up of people who have a history of polyps. But we've resumed, and we're doing all of that now. Still, just like we were before, or had been before COVID hit. We had not been doing our hemorrhoid banding for a while, but we're actually doing that back again too.
Well, I'm sure all our viewers would also like to know, how are you protecting yourselves as well as the patients through this pandemic?
Right, that's a good question, and certainly has been our concern moving forward. We were eager to start our procedures back, but we also wanted to make sure we did it in a way that was going to be safe for us, our employees, and for our patients. And so the Department of Health has instituted some recommendations about that. They feel like they've recommended that anybody that's having an elective outpatient procedure needs to have COVID testing prior to the exam. And so we're doing that. We're having our patients come in about 4 or 5 days before the test and getting a COVID swab. And we get that back and then, make sure that it's negative. I've actually had 2 patients come back positive. They didn't know they had didn't know they had it, weren't having any symptoms. And we postponed those procedures out for a while. So COVID, pre-testing for COVID, and also everybody's wearing masks. We wear a mask, our employees wear masks. We're asking the patients also to wear a mask when they come in.
What happens if one of your patients has been known to be have COVID-19 before their procedure or have been exposed? What are you doing about that?
Well, there's not a lot of good recommendations on that. We've got some guidelines we can follow with regards to our employees and when they can return to work, 14 days of quarantine plus, make sure they're symptom free for a few days. But for our patients, we've just sort of generally said about a month. If you were exposed, had a high risk exposure, or you were affected yourself, we're just saying, unless it's urgent, let's just wait a month and reevaluate it at that point.
Well, interesting you say, unless it's urgent. What do you qualify as urgent? Because I would assume if I feel like I'm supposed to be coming in to see you for the operation or the procedure, that would, in my mind, be considered urgent.
Right, and it's going to be case specific. There are some things that you certainly could wait a month or 2 on. Screening exams in particular, there's no urgency for those. People who have a stable chronic problem that we're investigating a little bit further, that could probably wait. If somebody's having anything, urgent, we would just assess that at the time and make a decision.
Well, as always, Dr. Ricky, you give us great information. We appreciate the time that you took with us today.
Sure thing. Thanks, Troy. I appreciate you having me.
If you want to find out more information, there it all is up on the screen. Gastroenterology and Associates, taking care of all your medical needs. We'll be back after this short break.